awkwardly. And if I could give me just a little pressure into my fingers there, and if I'm on her teres minor, as she pushes into external rotation, I'm going to feel that contract underneath.
As opposed to teres major.
Yes. So if she pushes the other way, and I'm palpating, then that's going to be more the teres major. If I'm getting a contraction under where my hand is, if she's pushing this way to internally rotate. So the teres major, it's just below the blue one there, but basically that's starting just a little bit lower than the teres minor, and it's inserting just a little bit lower down than the teres minor on the humerus.
On the other side, too.
Yes. So when I'm needling this muscle, we're going to talk about some different hand positions. So basically what I was doing when I was needling the infraspinatus, I was using what's called a flat palpation. So with this one, we're going to introduce what we'll term a pincer palpation. So pincer palpation, basically I'm going to be using my index finger and middle finger as well as my thumb, and we're going to be kind of gripping up the muscle between our fingers, okay? So we can kind of separate and kind of pull the muscle just a little bit away from the scapula. And it is a summative rule, and this is going to depend a bit on your hand placement, but if you can use pincer palpation on an area, you can be pretty confident that what you're pulling up is not her lung. So you're not going to actually be pulling up and holding her lung. So if you just needle into what you're pinching up, if you're needling in a safe direction, you know you're going to be good. But from here, I know that's not necessarily fun here.
You do have to be careful that you don't direct it towards your fingers.
Yes, that's
and go too aggressive.
So if I've got my index and my middle finger under here, and I'm needling through there, obviously if I go deep enough, I'm just going to needle my finger through there. So what I do is I might use that grip to initially find and palpate the muscle, but then I'm going to kind of spread my fingers apart just a little bit, like if I'm needling down here. So I know even if the needle were to go all the way through the tissue, then I'm not going to needle my own finger. But from here, let me have you just give me a little resistance again here. Okay, so I'm feeling that tense, and basically I'm going to tap the needle in. And then when we're needling this, we're going to want to needle away from the body. So we're going to needle out in a lateral direction here. And then you're in the muscle. Look at that, a little deeper. There we go. And from there, again, we can piston, we can twirl, we can do whatever we're going to do.
You hold it while you do your manipulations?
I typically do when I'm on this one, but then if I'm going to let it sit, obviously I'll let go. But if I'm just using a pure pincer palpation here, again, as long as I'm only needling into tissue that I'm pinching up, I know I'm going to be safe. But in general, with this one, we're going to be wanting to direct the needle laterally away from the spine, towards the outside of the body, and or towards the humerus, depending on the position. Okay?